De qual céu mais você vem?
I am Dr. Idrees, consultant ophthalmology, currently practicing at Ali Medical Center, Islamabad, Pakistan. It's a great honor for me to present a talk about PCI and new specific lens at this prestigious international conference. I am thankful to Dr. Pedro Grimaldos for inviting me on this conference and presentation. I have no financial interest regarding this presentation. Photoablative cosmetic iridoplasty is a delicate high-tech procedure which is done on the surface of the iris for causing a favorable change in eye color. The procedure is complex and needs a high level of expertise, technique, and technology, but we can always learn this procedure like any other skill. How PCI works. Melanin is contained in the melanosomes of densely packed melanocytes under the anterior border layer of the iris. Laser interaction with this pigmented polymer causes it to coagulate, and necrosis of the melanocytes takes place instantaneously. The dead melanocytes are engulfed by tissue histiocytes by phagocytosis and removed by the rich iris vasculature. On the average, at about 10 weeks, the process is usually completed. The iris stroma is exposed, showing the underlying color depending upon the density and type of melanin in the posterior pigment epithelium of the iris. It's very important to understand the iris surface topography. Iris has two parts. Peripheral part is ciliary zone, inner one is pupillary zone. The border between these two zones is at collarette. Under the pupillary zone lies the sphincter pupillae muscle, and the dilator muscle is in the ciliary zone. In the ciliary zone of the iris, there are contraction furrows and folds along with crypts. In the pupillary zone, the contraction folds are radial, while in the ciliary zone, the contraction folds are circumferential. It's very important to understand the iris for this procedure. Iris is the most complicated eye structure to be treated with laser compared to cornea, lens, retina, trabecular meshwork, or vitreous, which we treat with laser. In the iris stroma are connective tissue, collagen, histiocytes, macrophages, which remove laser ablative melanocytes in 8 to 10 weeks, along with pupil dilator and pupil sphincter muscle, blood vessel, nerves, melanocytes, which are our most important target. It's very important to understand this slide. Anterior border layer, under that lies densely packed melanocytes, which we treat with laser. In the stroma lies blood vessels, nerves, and at the periphery is major vascular circle, and under the collarette lies minor vascular circle, along with pupil sphincter muscle and pupil dilating muscle in the posterior iris stroma. Behind lies the pigmented epithelium, which has got two layers. Anterior layer is less pigmented compared to the posterior layer, which is quite densely pigmented. Why we need the PCI lens? Iris has a unique and complicated microanatomy compared to other structure of the iris, other structure of the eye. Iris surface is irregular and has depressions and elevations on its surface. We need to abrade the melanocytes under the anterior border layer of iris and in superficial iris stroma. The most important aspect is to avoid any collateral damage. Precisely focused laser delivery at the target tissue is of extreme importance. What's the importance of PCI lens? Laser shots, if we apply too deep in the iris, they are quite harmful to the delicate iris structure and causes scarring and charring of iris, and rather it becomes counterproductive. Too superficial or anteriorly placed laser shots are just a wastage of laser energy without any outcome. So we need a magnified, sharply focused iris surface in view for this procedure, and we need well-targeted and precise laser delivery. Iris response to laser delivery is easy to monitor with this PCI lens. My journey to developing this PCI lens, first I started direct laser delivery to the iris surface, which caused many uncomfortable problems. Then I started delivering laser to the iris surface with the help of Goldman 3-mirror contact lens, but results were not still very comfortable and satisfying. So next what I did, I customized the Hack Street Goldman 3-mirror lens, but still I was looking for something much better than this. Then constant research, trial, error, and experimentation led my way to developing PCI lens with the help of Volk USA and Mr. Peter Hohns, Senior Vice President of Research and Development and Technology from Volk, came to my rescue to develop this lens. This was the Hack Street lens which I used for some time. And then with the help of Volk, three prototypes were prepared. One was selected to be the best for performing this procedure, and that prototype was 12630. And I am still using that lens for the last 2 years to the best of my satisfaction regarding the outcome of this procedure. This is PCI lens which I am currently using. This is 12630 lens. What's the technique of using this lens? Before using the PCI lens, it is always better to ensure that its optical surfaces are clean and free from any debris or dust. It's always better not to use it on any infected corneal or conjunctival surface. I use this lens with 16x to 25x slit lamp magnification with a clear, sterile, dispersive viscoelastic without any air bubble in the gel. After using it, I clean it with alcohol swab. This is Idris laser ABF plate on the left side, which I use for fine focusing the laser aiming beam. Then is dispersive viscoelastic. Then is the photograph showing iris surface with 4 treatment zone, which I use for my technique. Zone 4 is outermost and zone 1 is innermost. Between these two zones lies zone 3 and zone 2. This is how iris appears at 10 weeks following PCI first session. The outer iris shows depigmentation, a change in the color of the iris, while the inner one shows the original iris color. This is another photograph showing outer iris at 10 weeks following PCI having a very favorable change in iris color, while the inner half is still having original iris color. The advantages of PCI lens, it provides a well-focused magnified view of the interior iris surface, and it's very useful for causing iris depigmentation with minimal consistent laser parameters. Hence, the most important aspect is minimizing the risk of any possible or any potential risk of complications of PCI procedure. Other potential uses of this lens includes laser capsulotomy. It's very useful in my practice, along with performing laser iridotomy for narrow angle glaucoma and laser treatment of anterior capsule phimosis following phacoemulsification with IOL implant. Its diagnostic uses includes pigmented and non-pigmented iris lesions, IOL implant tilts, anterior and posterior lenticonus diagnosis. Special thanks to Mr. Peter Hohns of Volk, USA. I am personally thankful to all of you for your kind attention. In conclusion, PCI is a safe and effective procedure in causing iris depigmentation, causing a favorable change in iris and eye color. For this, PCI lens is of critical importance for the successful outcome of the procedure. I am working on to add few more clinically important features if Volk USA decides to proceed with the commercialization of this device depending upon market demand. Thank you so much. In case if someone has any question, I have my email address Anyone interested can contact me. Shall be pleased to answer whatever may be the query. Thank you so much.